we've got quite a lot to report on what's happening with the coronavirus, but also some of the responses want to really identify some really good examples of leadership. And we'll be doing that. I'll ask John to make a short input and encourage comment on that. And also planning to go through one or two recent papers that I've got here that I think are particularly interesting, both on vaccines and on epidemiology. To get us all going today, I'd love to introduce Tui, our Head of Communications, and Tui, you have the floor.
Hello everyone, lovely to see you all there today. I'll launch the poll as usual. For those who haven't done it before, there are 3 questions. The first one, please select where you are joining from. Once you've selected that, scroll down, select the age range, and then the final question is how you're feeling, and you can answer more than once for this one. So we'll leave that open and then we'll come back to it later. It's our way of feeling how you are all in the room despite being a virtual meeting. Thank you very much. Back to you, David.
Oh, wonderful. Thank you very much indeed. So internationally, when WHO friends add up all the numbers from around the world, what are they finding? Well, 500,000 new confirmed cases in the last 24 hours. This is a huge, huge number when you compare it with what we were seeing earlier in the year. 500,000 in 24 hours. And it stayed around that level for the last 3 or 4 weeks. It's not massively increased, but it's also not decreasing. And what's kept it at this plateau are really quite significant reductions in the numbers of cases appearing in Europe, not completely down to 0, as I've said before. The European numbers are staying high with quite a concern in the United Kingdom. They are still a quite large number, well over 10,000. In France, well over 10,000. And so this is still a cause for concern. So that's the Europe story, plateauing. Let's go to the United States. Well, there we are still in a situation of continued increases, with the daily death numbers in the United States in the last couple of weeks have gone up from 2,000 a day to 3,000 a day. And I mean, this is just extraordinary in any other circumstance to have a disease that's killing 1,000 more people per day this week than it was 2 weeks ago would be an immensely worrying phenomenon. People would be running around in circles. I mean, it is an awful situation. Plus, looking at some of the data overnight, there are other indicators from the United States that we just need to be aware of. It seems that cities with a COVID test positivity rate of more than 10% in the United States have got a greater than 80% bed occupancy and a greater than 80% ICU bed occupancy. And when there's more than 85% of ICU beds occupied in the US system, the flexibility in the system to keep going is greatly reduced, because that level of occupancy is generally associated with a very high demand on staff. And as soon as you get to that level of demand on staff, then the rest of the system, in the US at least, doesn't work. Just to, I mean, I've got a little bit more on that. It was an article in the New York Times but drawing on material in the Journal of the American Medical Association, I think. So in the United States, my little assessment as of this morning is that it is disturbing news. It doesn't mean that everything is all terrible in the United States. In fact, I think there's a lot of minds focused on what is happening in that country. It's just to say the numbers of cases, the percentage positivity rate in different parts of the country, hospital occupancy, all quite worrying. And so in the open pages of the Journal of the American Medical Association is quite a long article, multi-authored article on the assessment of racial and ethnic disparities in hospitalization and mortality in patients with COVID-19 in New York City. And what this was basically looking at was, once again, are Black and Hispanic people getting more nasty COVID because of them being Black or Hispanic, or is it because of occupational factors? And just once again, this particular piece of work, which is not fully peer reviewed, but is still it's from a group that have very high reputation, and it's studying 9,722 patients in New York. It's basically saying that these extra deaths in BAME communities are not due to race or ethnicity on its own, nor are the high rates of death due to comorbidities, but more generally because these people are more likely to live in crowded housing, to do essential jobs with high exposure. They're more likely to use public transportation, and they have not had routine access to medical care in their lives. These factors, i.e. the social determinants, seem to be more important in determining risk and outcome than their race or ethnicity. Super important in my view, and it's corroborating what we've seen from other studies, but this is a big one. And so what I shall go on holding in my head is that the excess mortality among Black people and brown people in United States and in other areas is not because of anything to do with genetics. It's to do with where they live and where they work. Be interested in any comments on that. In terms of transmission, new information, I would say that we still get some reports suggesting that as well as droplets, there's also spread in frozen food. There's also spread occasionally by aerosols. And there's quite a lot of material in China showing that in frozen food, a virus is not only present, but is actually viable. And that this is super important for all the pieces of work that are underway to look at the origins of this virus. Some of you will have seen that there are data from Italy suggesting that a virus with the morphology of SARS-CoV-2, i.e. the COVID virus, was present in people at the end of last year. This is coming from antibody studies mostly, studies that were of bloods that were taken routinely from cohorts of people looking for cancer markers, and they found antibodies to the COVID virus. This is, of course, complicating the studies of the origins of the virus, but it's now two observations suggesting that there may have been this virus being transmitted in Europe last year. I think we just have to hold that. I don't think it's possible to know where to put that observation in forming the picture. And, you know, because we're so sort of acute and live with discoveries on COVID, we do have to remember that often when you're trying to feel into a subject with a new pathogen, not everything fits together at this sort of stage, and you need to let some findings lie and work out their significance over time. More studies in the last few days on long COVID, all the time pointing out that there are what we would call morphological changes to body membranes in people with long COVID. I mean, I don't really like talking about it very much in front of people who I know are experiencing long COVID, because it will add to the sort of general sense of not feeling good about it. But I think we do need to be realistic that long COVID may well turn out to be associated with other sequelae, of course, like mental illness, but also likelihood of blood clots and so on. So adding together epidemiology and factors on who gets the illness and so on, it's still very, very serious. And I just looked at countries around the world. So the European surge has been halted. It's not reduced down to zero, but there is a new surge happening in South Africa. There is a surge happening in Japan, and there's a surge happening in South Korea. And my own judgment is that there will be surges at various times that pick up in different parts of the world and that will need to be dealt with. I think no nation that is experiencing little COVID right now should assume that that situation will stay for the foreseeable future. That when you're low, it's quite possible, especially if there's a lot of movement, that the incidence will pick up again in a month or two. And I kind of suspect that this surging and ebbing and surging and ebbing will go on in different regions during the coming months until we are able to ensure that sufficient people are vaccinated to stop the pandemic from continuing to spread. Now, in terms of the vaccination, there has been quite a lot of excitement in the last few days because two people who had the Pfizer and BioNTech mRNA vaccine, the one that has to be kept at -60 degrees centigrade, two people had a severe anaphylactic reaction. Basically, that means that they were really quite ill with dizziness and drop in blood pressure and needing to have some support. They were two people who were known to be allergic to different substances, foods and so on. They both had EpiPens, which are adrenaline pens that are used to keep you going if you have an allergic reaction. And I think the general view is that people who are known to have these allergic reactions should not be taking the vaccines, and that now has entered into the UK instruction manual. But I think it was a bit scary, and people will be keeping a close watch for these kinds of reactions, which should be pretty rare. Normally, when you're bringing a vaccine onto the market, you want to have one anaphylactic reaction in about 1 million vaccinations. You have to keep a watch if the frequency is much greater than that. I continue to hope that it'll be possible to get phase 3 data from the AstraZeneca and Oxford University vaccine. This continues to confuse me. I think it'll become clearer over time. I think that my efforts to communicate the reality that at the moment the vaccine will reduce deaths in certain high-risk groups, but will not be a primary mechanism for reducing the pandemic. I mean, that message is getting into circulation, but I think everybody is aware that the other message of the vaccines here and life will go back to normal is percolating through social media and through mainstream media certainly in Europe. This has two impacts. One is that it makes it really hard to maintain the emphasis on non-pharmaceutical measures like face masking, physical distancing, self-isolation when sick, lots of hygiene, and protecting those who are most at risk. And so keeping the message about non-pharmaceutical measures is really, really important. And secondly, all the talk about vaccine, particularly in industrialized countries, is leading to a build-up of resentment among people in other countries, saying, how come, as always, the rich countries are able to get this stuff and we poor countries have to wait for the crumbs to come off the table? And I kind of think that there will be an increase in emphasis on this. It's not quite sure how that will be reflected, but it's really frustrating for people in poorer countries or people who've not done this scramble to buy a vaccine. It's frustrating for them to perceive that they are in a different position in the queue. So our colleagues in WHO who've developed the COVAX facility, which enables people all over the world to be able to access vaccines at a lower price, they are making just one point very clearly, which is they are short of cash. This COVAX facility will only work if there is enough money in there to lubricate it. And Gates are putting in more money. They put in another quarter of a billion yesterday, which is very, very welcome. But actually 5 billion plus are needed at the moment, according to the COVAX teams. So I'm going to increase my own personal advocacy for more money to go into this vaccine facility of the WHO, so that there is a prospect that people in poor countries will be able to access the vaccine. We are continuing our efforts to encourage community-wide honeycomb responses, integrated incident response teams at local level, and much better public health. This requires a leadership style that we've called living systems leadership. And there's more and more interest in that everywhere where we're asked to speak now. We are invited to talk about what this style of leadership is and whether or not it's relevant for other crises. And I thought I'd invite John to lead a bit of a discussion on this. And once he's made his remarks, then I'm very keen to get a bit of a discussion going on it, because not only do I want to define that leadership style, but I want all colleagues to be thinking perhaps more energetically than ever. How can we, as we move towards Christmas, really get more attention to human-centered living systems leadership, which is so important to getting ahead of this virus? John, you have the floor.
Thank you, David. I just wanted to sort of pick up on this from one particular angle, and that when we talk about living systems leadership, we're saying look at the world as if it was an ecosystem, which we think it is, and don't treat it as some big machine that you deliver things to. We deliver pizza, we deliver letters, we don't deliver healthcare. People are active in their own health by the choices that they make in their life. So when we start to deal with something like COVID, and Annie's note in the chat about systems relates exactly to this, it impacts on all sorts of very interrelated things that are going on. And so how do you see that, and how do you make good choices as to what you might do and what might be valuable and what would be helpful, rather than throw up those unexpected consequences that might be so damaging? So David and I have been exploring this, and we think there's perhaps 5 things that we're doing that help us to see what's going on in any situation. And we thought it might be good to share those with you this morning. The first of those is to look from the other end of the telescope. What's really going on beyond the focus of attention? So in terms of COVID, there are people who are excited by the efficacy of mask wearing, and they study mask wearing and how much infection does it block, what's the impact on it, what's the impact on a community. But if you're looking beyond the end of the telescope, you're looking at, well, how do people wear their mask? Are they putting it below their nose? Are they only whipping it on when they think somebody's watching them? What happens in the whole of the rest of their life, and how does that fit into it? So when we look through that one narrow focus, we see the thing that we're looking at, and we see it in great depth, and that's valuable, but we're only seeing one piece of what's actually happening. And so look beyond the end of the telescope is the first thing. The second thing that we try to do is to move between levels. So levels, for example, of global. What's the global picture of what's going on? Because people with a global perspective clearly are viewing COVID in a different way from the various national perspectives. The national perspectives differ quite a bit, and that's not surprising. Countries are different, countries have different histories, but there's 2 different views there as to what's happening. And then the national perspectives differ quite a bit from the very local perspectives, from cities, particular cities or particular parts of the countryside. And then those may differ quite a bit from community perspectives, where very specific pieces of information are happening, but not necessarily with the global view of what's going on. So to be able to move easily across levels seems really important. The third thing we talk about is understanding people and places. Understand what's really happening, because what appears similar may not be similar, or it may be similar but for different reasons. So we spoke on Tuesday's call about mass testing, and we spoke about Liverpool and Slovakia, and there's many things that are similar between them, but there are also very specific differences. And if you don't understand the difference between searching, or the impact of searching for people through credit agency ratings, as opposed to searching for people because you have a national public record of every citizen, you won't understand necessarily why things may be arising that are different to those that you could have expected. The fourth of these, for me, is really, really important. And it's a bit of a tongue twister. It says, search for what's really happening. Go and try and work out what's actually going on. And then search for what connects what's really happening. What's happening in one place and what's happening in another place, and what's the connection between the two. And then the final bit of that one is, and then search for the patterns in the connections. So rather than think about the things that are happening, think about what connects the things that are happening, and then what does that tell us as a whole? And for us in COVID, looking at universities in England has been quite interesting, because there were a lot of assumptions about what students were doing and not doing. And what you find is some really quite interesting data about infection control and suppression of the virus that weren't immediately obvious. But are those patterns transferable? It depends on all sorts of other circumstances that you need to that bumps into. And then the last of the 5 is remain curious. Remember just how little you know rather than how much you know. And in some cultures that would be called beginner's mind. But when we feel we're an expert in something, we tend to feel we have to provide an answer. And when we feel we're a bit of a novice, we're eternally curious, and it feels okay to ask questions. And the people that we find that we bump into, David, who are telling us the most interesting data are not people who think they're an expert and have got an answer. They do know a lot of stuff, but they are exceptionally curious about what's going on in their place, in their country, in their university, in their city, and how do they know, and what does that tell them else? And so they keep forever inquiring. And we think those 5 things have been really helpful. Look from the other end of the telescope, move between levels, understand people and places, search for what's really happening and the connections and the patterns, and remain curious. Be really interested to know what people thought about some of that.
There's a sort of single organizing principle that came to me while I was listening to you talk, John, and it is putting others' perceptions of what's happening, putting others' experiences as central as you possibly can in your thinking, and never assuming that you know it, always being ready for surprises. I found that very, very strong. Your focus on eternal curiosity, your focus on identifying patterns, your focus on listening to people in different places. I mean, have you been doing this all your life, or is this something that's come to you late on?
I think I've been doing it all my life, but I think I wouldn't have been able to articulate it, David, until much more recently. I think it was something it's just the way I was brought up probably as a child was to have this curiosity and for it to be okay to be curious. But also I think at the heart of it is a valuing of what others are experiencing for what it's worth. If somebody says this is how they feel about it, that's how they feel about it. You don't say, well, you shouldn't be feeling that. You should be feeling this. I never found that a particularly helpful avenue in any conversation.
And can you lead in a resolute and well-defined way if at the same time you give so much value to the experience of others, or is there an incompatibility?
I think what it allows you to do is to articulate a story that everybody can resonate with, or large numbers of people can resonate with, because the source of that story is their lived experience. So that when you start to shape the narrative that directs the activity that you want to make, people immediately see that as real. They see that as tangible. They say, yes, that's right. So I think it's not a case that you sort of give over and give everything over to everybody else and it all becomes a sort of messy uncertainty. I think what it gives you is a clarity in what you're trying to explain that connects much better than people who are trying to do that from quite a distance view and haven't really felt what is happening for people, what is going on between organizations. It comes most often leadership messages come from a very particular perspective. So I think it's quite a broadening approach.
Lovely. I mean, I'm really keen to hear from others, particularly those of you who've tried the sort of experiments, the curiosity experiments that John has done. And because what I want to know is how can we create an essence of this people-centered living systems leadership style that can then be drunk for morning coffee by people all over the world so that they can lead in a more authentic and empathetic way. So who would like to, if anybody, come in with discussions either on that or on the broader epidemiology that I'm talking about? Got a nice comment from Annie has come in on the chat. Of course, we will now come first to you, Annie. And I'm just going to see who else feels that they can contribute to this. And Rhiannon, it would be quite nice to get your perspective. I think what I'll do is any perspectives that come in as you're talking, I'll do my best to do my own Peter Morey type rich picture development and then feed it back to you. So Annie Feltham, please.
Thanks, David. Hi, everybody. I completely support what you and John have been thinking, and it really comes back to this that we all live in separate places. It's an integrated system approach. And yesterday I was commenting on new proposals from the Department of Health about integrated care systems. And it misses what you're talking about. And some of this, in terms of delivering healthcare, comes back to power relations, putting people as patients. It's all of this stuff that we need somehow to break away from. And so I think there is some thinking about it, but it's got a long way to go. So the messages you gave, John, were really clear and really exciting. And then I suppose just to go to my first contribution this morning of what's happening over here in the UK with the no deal Brexit and the continuing struggles with COVID and the very high death rates which we still have in this country. It's going to put huge challenges to our whole system and our places within it, and actually how people are encouraged to be able to express themselves, to trust the government, to see their place and their contribution. I think we're going to be like a big Petri dish over the coming months. But I really hope that we can cope with this. And I think we're going to need a lot of help and support, and a lot of help and support for our government too, because you'll see the sort of language that they use shows that, as I've said before, we've got a long way to go to get to the 5 points that you both have articulated. But I think that's a brilliant contribution, so thanks very much.
Thanks very much, Annie. John and I are going to continue stressing that the virus is the enemy, if we don't mind that sort of language, just for today, and that people are the solution. And if people are the solution, then all the points that John's talked about, curiosity, working at different levels, connecting with people in their places, trying to understand patterns and being eternally humble, really. We're going to keep staying that and connecting with others who are saying it, because now more than ever, this kind of thinking has got to come through to avoid the sort of fragmentation that you are identifying. I personally don't think you are wrong at all, but let's hear from others.
Yeah, I'd be very happy to join in those efforts. I think it's very exciting.
Yeah, okay, that's great, Annie. And I mean, this group, as I see it, is an immensely powerful resource. I was going to invite Rhiannon Osborne, if she wants to speak about this, what we're discussing generally, or also the slightly difficult global situation that we're moving into on access to vaccines. Rhiannon.
Yeah, sure. So I actually had one question about your leadership framework. Are you targeting it more as at individuals? Because I have an interesting experience. So I'm leading like an advocacy organisation in the UK, and I thought I was doing quite a good job of like leading it, but everything's become a lot better now that I've trained up loads of other people and other leaders, and we're now leading as a team. It's just so much more effective, and I have so much less stress. So I was wondering.
So stop there. Basically, you're saying, if you really want to support this kind of systems leadership, work with groups, don't just work with individuals, because individuals quite often feel overwhelmed. Is that what you were trying to get at, or have I put words into your mouth?
Yeah, no, also, so a capacity issue, like to do amazing things, it's really hard as one person. And I think like sometimes when we focus on leadership, we do get a bit individualistically obsessed. We're like, oh, we have like these great leaders who will do X, Y, and Z. Whereas actually like lots of the really great changes have been a group of people or a coalition of people who all have their own leaders, but all coming together to lead in a similar way on a particular issue. So that was just like from my very small scale experience in this one organization. Things have become more effective now that I like have given like public speaking training and like delegated quite big opportunities to other people, and now we're all kind of co-leading, and we're just able to do more, and you get more. So for example, with 5, you get more. So like with remaining curious and not assuming you're an expert, like
Yeah.
I learn a lot more about my mistakes and where I can improve by having an open team environment of people who are willing to challenge things and stuff like that. So I think we've been doing 5, the remaining curious and learning, but as a group. And I think just because of more brains is more ideas, you get more things. So I don't know whether that would be something worth expanding on in the framework. I don't know.
Well, we're gathering everything, so that's great, Rhiannon. And thank you for your own experiences. Go on to your second point.
Yeah, so then the next thing I was going to say, so I only have 2 more points and it hopefully won't take too long. So with the levels thing, I definitely get it, because it's really frustrating when you're like just one small person at your uni and you're looking at huge global problems like climate change, and it's like, okay, well now I just want to spend all day in bed because I'm so sad. But actually what you do is what I found really useful is you try and learn as much as you can about like the big picture, like the historical aspects of climate change, like the global inequality aspects, and you have these big things, and then you try not to let them overwhelm you, and if they do, it's fine. And then you look at your own life and your own influences, and you work out, like, with this big global perspective, what level that can I contribute at? And then it's much easier to not be overwhelmed and to not feel powerless, because you have this bigger picture sense of what needs to be done, but you're kind of removing yourself from the pressure of changing the world, and you do something more useful because then you evaluate where your levels of influence are. So it's like you look at the big global picture in number 2, and then you translate it into your life, and then what you do is more effective because you have that global picture, and you are better at strategy because of it. And then I think number 4, the connections bit is really important, and especially if you're trying to work on multiple interconnecting issues, it's really important to, in your mind, have a framework for how things link together. Like for mine, I think for me, my framework is health inequalities, but someone else might have a different framework. So if you're looking at vaccine access and climate change and all these other issues which are really big and scary, and like thinking about how they connect together through a common framework, I found really helpful. And it allows you to work on multiple issues without looking like you're disjointed, because if you have that framework and you have like you don't even have to articulate it, but if you know why you're working on those different issues and how they're connected, then you don't look like you're all over the place. And yeah, the vaccine access issue is super interesting. There's a lot of different, there's a lot of different things going on, and different countries have different priorities, and it's building on a long history of bitter arguments in this area. But I think I don't know if you saw, we put a letter in the Guardian this week about the CTAP, which was published. So that was quite good in terms of how it relates to COVAX. Which
very good.
But yeah, I think for the global access thing, it's really hard to understand why some countries like South Africa are so angry without looking at the history. So for example, in the AIDS crisis, like we had effective antiretrovirals for about a decade before they were widely available in countries like South Africa, because of issues with patents and intellectual property and data exclusivity and world trade rules. So I think a lot of, if you try and understand, obviously not you, David, I'm sure you know all these things, but like looking at the vaccine debate, I would really recommend looking at the history of HIV and AIDS, because then you'll understand why so many developing countries are really upset and stressed, because of what happened with HIV and AIDS and other diseases. Like they don't have a precedent for when people say, oh, we're going to do it together, don't worry, sorry about these bilateral deals, it's just what we had to do. It's really hard to take that at face value when you see the history of what's happened with access to medicines. So definitely look up what happened in AIDS. I'm going to stop now, sorry.
No, I've got a problem in my room that a blind was coming down automatically, and I had to ask for some help because I was stuck here. Last thing I want to do is to stop you. So you're saying, what you said was that if we see what South Africa had to cope with in accessing treatment for people with HIV, we would understand why the president made his remark yesterday about vaccine apartheid. at a WTO meeting.
Yeah. So for those who aren't familiar, as like one example, during the AIDS crisis, the South African government tried to remove protection on an ARV so that they could give it to their people, because it was like $10,000 per patient per year, because only one company was able to produce it. They wanted to allow a South African manufacturer to produce it, and they got sued by a coalition of pharmaceutical companies. Eventually, lots of campaigning made them back down, and South Africa managed to do it, I think, in the end, or it was given voluntarily in the end. They didn't have to force it. But that's the kind of like history with, you know, revolutionary health technologies that are helping in a global crisis. That's why countries like South Africa are so worried now.
Gosh. There are people on this call who were warriors through that struggle, and indeed still are. And I'd really love them to have a chance to talk and to relate to what many things that Rhiannon has said. I also really want to thank you, Rhiannon, for giving your view on your patterns and how important your patterns are for helping you advance through this stuff. It resonates very much with the way I have been at different phases of my life and still am. There will be, I think, some comments on it, and we may not get all the comments today, but we will have them on other days. So I'm going to ask Marianne and Fawzia and Anne von Bolowis to come in. I'm not deliberately just going to women, but that's the way it is for now. Marianne, please.
Well, we've been having a discussion in the chat, which I has found very interesting. Basically, it's a question of, if you're in one level, why are you there? It's because you're comfortable because of your expertise, knowledge, and everything else in dealing at that level. That's possibly where your starting point is. But also, there are issues to do with, can you move to another level easily? And the example, I can work quite happily at the global level in one sense, but I can't do anything locally because I don't know the people, because I haven't lived here very long. Yeah. So, and I feel powerless at the national level because, well, we won't put it in exact terms, but we're stuck with what we have, and it's difficult to change much. So there are issues of, but also what I was thinking as we were sort of talking amongst ourselves, it's a question of looking at things. Okay, if you've got your telescope going the wrong way, but even when you have your telescope going the right way, are you making the right connections? Yeah. We've talked initially, well, a while ago, about the importance of water in developing countries. We've talked about the impact on women in developing countries and in poor areas and so on and so forth, particularly domestic and gender-based violence. But it's a packaging, and I think I can understand a bit more what you're talking about with your honeycomb way of working. But it's the packaging that you have to keep changing your packaging to take into into consideration other issues. And finally, on that, I would say that, you know, when we're talking about COVID now, we've been talking about COVID. Here in the UK, we've talked about COVID and Brexit. Now we need to begin to talk about COVID and climate change. COVID is going to be here, whether we like it or not, until we all get the vaccine. Now, I know somebody's getting it on Monday, but it's going to be a long time before I get it, because I'm different grouping. But I'm in 3, he's in 2. But the point is that we, in developing your honeycomb, I looked at it face on. I now think of your honeycomb as going backwards several layers as well, so it's 3-dimensional.
Yeah.
And that's where it could get very interesting, is how we can actually get out of the honey itself
Yeah.
and actually do something.
Yeah.
Thank you.
Thank you, Marianne. And I was going to say, when Rhiannon was talking, presumably your patterns that you develop that help you to navigate are actually changing. You're adapting them in the light of your experience, in a sort of way that Karl Popper, that great philosopher, would have been proud of. And I think Marianne has helped hugely with trying to understand just the power of having these frameworks and the fact that those frameworks are constantly changing. Just to see if we can roll the conversation on. Fawzia, please.
Well, thank you. John, I just found that really fascinating, and just all that you said resonated at some kind of very deep psychological level, because we're talking about a real shift from a different kind of culture that most of us are familiar with and perhaps a little sick of as well. And if I can contribute to this thinking, I don't know where you are, what you're trying to do, but I would love to. And I just want to bring a couple of things that have emerged. I've been interviewing CEOs who lead health operations in hospitals in terms of their experience. And while it wasn't specifically about leadership, there were certainly things that came through. And one of the things was, that at the beginning of a crisis, leaders are really under pressure to appear to be decisive, which implies also a sort of speed of thought processing and coming to an opinion, and the correct one. Now, so while those who'd previously dealt with emergencies were sort of readier to kind of move than others who had not, what ultimately appeared important was what they did, not how quickly. And to Rhiannon's point, it was the forming of teams to deal with various things and to share the collective thinking and learning and decision making. So that was one approach of kind of admitting that they did not know it all, that it was better to allow for many voices to deliberate over and to delegate the thinking to those who were best positioned. And there was a lot of delegation, actually, of authority as well. That was one. Then the other sort of old-fashioned phrase that came in was the importance of communication. But what they actually meant, when I reflected on this, was encouraging a discourse and sharing an evolving conversation, which also meant that, communication suggests a little bit sometimes, particularly when leaders talk about the importance of communication. Often they mean something along the lines of having a good megaphone for their messages to others. But what was really the qualitative sort of difference between good leaders and the old style, and which was absolutely needed, was the not just the two-way, but the several ways, somehow sharing the latest of what was going on, so that, keeping everyone informed and part of it. In this, I just think there is, if we want more of this, there's got to be a different way in which we recognize and reward leadership. And I don't know the answers, but there has been a culture that have created the old school, and we will need to figure out what's required to promote the new way, where success is not rewarded to an individual, but somehow rewarded to a group. That's the sum of what I can articulate right now, but I'm really fascinated by this conversation.
You talked about sharing an evolving conversation. I think that's what you've just done. And for me, it was very special that you chose to do it. You can only share evolving conversations as a leader in situations where there's a pretty high level of trust. And that's a kind of nice thing that this is a group where the trust is high enough for you to be able to do that. Thank you, Fawzia, as always. To Anne von Bolowis, I don't know where you are in the world, but it's always fun to call on you and to imagine a map and then to put a dot on it, which is where your boat is. Come in, Anne. And thank you for...
Unmute. Yes, hello. Good morning from the Cape Verde Islands still. Yeah, lovely to listen to this very important, I think, part of the conversation, because this is really looking forward to solutions, not only to COVID, but to the larger systemic issues that we're confronted with. I would like to hop on to what the previous speaker said, and I think that is a very important point, that we normally measure performance or leadership as an individual. There is very little support to like joint reporting, joint result measurement, joint feeling of success. And I think what, just, you know, from some of my experience, I went for 1 week to the Santa Fe Institute of Complexity Studies in New Mexico, a very interesting place where they look at complexity issues. What they do there, they put different people into a room looking at a certain issue, not necessarily experts, but people that can really out of the box look at something and try to nail it, not just in blunt results or mathematical result-based framework, log frames, you know, the old school stuff, but look at it from a systems perspective. And I think there's a huge, there's a huge opportunity now to change certain procedures or ways of working that we need to allow for these multi-stakeholder partnerships to arise. And I also saw, you know, what I think was interesting is at the onset of COVID, there was sort of like an emergency state of being of the systems. And then suddenly some of the rules didn't seem to be so important anymore. Nobody was really bothered to follow the rules, but now the rules kick in again, and everybody things get stuck again. So it's trying to create another ecosystem that actually allows people to trust each other and institutions to work together, and not just looking at the experts, but really involving people that have a feel with it, because that's the most important. Thank you.
And I mean, it's lovely. You've really picked up and moved it forward. Ecosystems that encourage trust, ecosystems that encourage experimentation, unusual behavior. All that's what I got from you. Thank you very much indeed. John, I hope you're going to be okay to come back before we close. So could you jump up and down, John, at a point when you need to come in? I don't want to squeeze you too tight. Sarah Phillips had a comment. I'm just checking I'm up to date, Catherine. Is there any more? Right. Sarah Phillips, but also Holly's turned on her video. Always an important sign. She's in the car, she's turned on her video, and this is almost the time where I'm going to ask Holly. So here's the thing, Sarah first, then Holly, if you don't mind, and then we'll go back to John. Sarah, please.
Thank you. Brilliant discussion, isn't it? Really interesting what everyone's saying and the different ideas that everyone's coming up with. And I just really was caught by what John said about systems. I just see things as systems. I didn't know it was different. I didn't know it was unusual until I started working in a big hospital in London and doing things there. And then you realise people don't. And then I did this master's in it and doing psychodynamic stuff with it and all that, and with systems as well. And you start to lead with that and you start to use that. but recently it's the societies and the involvement I'm with in areas, it's come to the fore. It's like, well, this is useful now. Finally people are saying, oh, we should do this, we should do systems thinking, psychodynamic, whichever. And it hasn't had a space really. It's like, what's that? What is that? And now it's like, well, this doesn't work if we say we're going that way, or if we say we're going that way, or it's mechanistic. But it does, the only way we can do it is to have this bigger picture and to think of all the elements there. That's where the leadership's working. And where I've noticed more recently, and a response personally was in a Facebook post, was a silencing feeling. Well, this is what we're doing, and that's it. And you think, well, that isn't it. We have to all remain curious. You don't have to do this as a leader. You don't have to present this fact. You have to kind of remain curious and allow others to be curious. And that allows that whole system then to come in, rather than presenting this definite way, and this is how we're doing it, which actually silences people, I think. I think hopefully that's got some clarity in it. Thank you.
Sarah, something super important in there, that if you're too definite, you silence people. Do you want to just develop that a couple more sentences, or is that as far as you want to go at the moment?
No, I mean, you see it quite a lot, and people in, I've seen it for years in boardrooms and in healthcare and in nursing even. Major incident in London that I worked on once, one of the senior staff said, well, I don't know why the police are getting counselling, because we don't need it, do we? And actually a few people looked around and were saying, well, you could see they were horrified, because they wanted to think, well, gosh, I've never seen anything like this before. So sometimes you get people who think they're giving this clarity, and that, now who was it that said, I think Fawzia said something about this need for this in the interim. When we had the major incident, we were all, well, when we were all like, boom, 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 there's a need for just everyone doing as we need to do, and that's it. And then later on, the need to exploration and curiosity and that's where we're at now. And I feel that we're very, well, in the UK, we're still staggering towards it. So, well, we're going to do this. And I'm like, well, why?
But Sarah, staggering, but goodness me, there's a lot of movement towards this way of thinking about among many people in the UK right now. And I'm super positive about this. And just to jump to Holly, to come in any way you want to, or not, if you prefer to be left in peace.
Morning, everybody. It's lovely to see you and a great conversation. The first thing I wanted to say was just, I think that when John said earlier about, he was brought up like that and is naturally curious, just to say, I think I'm quite a naturally curious and I'm really interested in patterns, but that wasn't my experience as a child. And actually working for John quite a while ago now, but having someone around who says, oh, what about this? Or these are my stories from the week of things that I've experienced, and noticing how do we make sense of those together was one of the things that has allowed my natural curiosity to build. So you can teach people how to do this. It is possible. I think it's also a practice. So as a leader, it's not just, you're not leading kind of the charge, as it were. You're constantly building capacity. And that the thing that Sarah was just talking about in terms of, people's desire for certainty, that's one of the things that I think we have to build, which is helping people have fuzzy edges about what they know and be in that space with them. So I think my recent experience of this related to COVID is that I'm helping a place think about isolation. And we started with a very small idea, which is, could we get all the public organisations in the place to come together to talk about supporting their employees to isolate? And then the thinking started to grow, and I've got quite an enormous plan, and I could feel myself getting carried away. But I was watching the group and they're going, oh, you can feel their stomachs kind of scrunching. And so I'm saying, tell me what's going on. What are you worried about? What are you seeing that makes you feel like that? And suddenly I had access to all this data about, well, we can do it easily, but what about our suppliers? And what about the big employers locally? And so we started gathering more data, more information from their perspectives. And then the next process for us is to inquire into, okay, so what is it here in this place that stops people from isolating? So I think that I've got a certainty about an idea, but I'm going to be curious about what other people's thoughts and reactions to that are, and then follow those. So those are my experiences at the moment.
Good on you, Holly. I'm just thinking, I wrote down while you were talking, you exercise leadership by creating space within which people were comfortable about sharing their anxieties.
Yeah,
that's super powerful stuff.
And it's deeply important. Yeah, it really is important to be able to do that, because otherwise you're not really connecting. You're not really able to see the full picture of what's going on for everybody. Yeah. And one of your colleagues mentioned it earlier, David, in terms of saying, you know, people are so trained to perform in a particular way in a culture that says, we've done this, I did this, give me a gold star and a tick, please. And that isn't the culture that we need right now. So, but I'm also very hopeful at the moment, because I think, like Sarah said, there really is a time for this, because all the things that we've tried before are not working. So it's quite exciting.
Yeah. Thank you so much, Holly, and thanks for just taking the tone up nicely at the end and giving it a wider resonance. William N., my brother, you don't have your video on very often. Noting that your video is on. Do you want to speak?
Well, I've said in the chat, and I've spent all my life working in corporate management, so I come from a different world here, and I come from a world which is explicitly hierarchical, and it will regard the whole honeycomb approach to life. It does regard, because it's already being confronted with it. It regards it as undermining and threatening. And therefore, what really interests me is what approaches living systems leadership, systems approaches, multi-dimensional, multi-directional leadership has in order to deal with the reaction that it is getting and will intensify from traditional hierarchical structures.
There you go. There's a good challenge. Thank you very much indeed. I think Rhiannon's come in right on that point. I couldn't read it quickly enough. It's always so difficult to stop and say we have to find a way to close this, but we do. Just the nature of life. Let's go to John. John, no pressure, but you might want to play with some of the strands.
No, happy to play with some of the strands. I won't pick up William's strand because I think it's an opening of a very important conversation, and we're at a point in the conversation where we're closing things. But that has been my life, William, as to how do you deal with this apparent clash, and in some cases very real. But I wanted to pick up some things, particularly I was prompted from earlier bits of the conversation. This idea that in moments of crises, we have to rapidly adapt as leaders, but we also have to hold a line through it that helps people sense what we're rapidly adapting towards, even if we can't explicitly name it at that point. And I think that line is some people would say a moral line or a values-based line. It's about what really matters here as important principle, and that allows the rapid adaptation to happen around a direction that everybody feels is important. And that sort of leads on to this idea that collective learning is so powerful. When you get little groups of people trying to work that out, you don't have to then sell any message. They've already decided what the right way to work with it is, because they've made sense of something that is complex in a way that an individual never could hold all the strands. It's too much. So when small groups of people or large groups of people start to work on these things together, they then know what the right thing is to do, and you don't have this corporate comms sell process that says we've been up to the mountaintop and we've found the answer and this is what you're all going to do. We've already created a group of people who are doing the things that needs to be done. And that led me to where I would close from me, David, which is a phrase that I've tried to live my life by and not always done it very well. But somebody said, I can never remember who it was, There's no limit to what you can achieve if you don't give a damn who gets the credit. I think that what that does is it means that as a leader, you create space for a lot of other people to bring their own brilliance to the party, as it were, and you don't take up space with your own need for affirmation and recognition and success.
Wow. You don't take up space with your own need for affirmation. How much time is spent pandering to leaders' needs for affirmation? How much space does that take up? It's just a question to us all. Sometimes it takes up quite a lot of space, I believe. John, thank you. I saw that Julian Delamontex was writing in the chat, but I see there's 59 unread messages in my chat. So I think that I just have to leave it. And instead, I go to Twee and Peter Moray to finish us off. And I'm sorry for the bad timekeeping, but I was having too much fun. Twee, if you could talk and then pass over to Peter, that'd be great.
We do. Thank you, David, and thank you all. So just the results of the poll quickly. Most people joining from Europe as usual, but great to see a few other regions represented there. Good spread across all the age ranges. And today, most people, the most responded to emotion there is positive expectation and belief, which is great because usually it is optimism, hopefulness. And just to take this opportunity to say, I'm putting in the chat shortly the link to our survey. So practicing what we preached and taking a systems approach and hearing from you about how we move forward into 2021 with these open online briefings. Please do complete the survey and let us know what you've enjoyed in series 2 and what you might like with a series 3. And next week will be our last 2 open online briefings for series 2. I have some surprises planned, so bring your festive cheer if you have any.
Surprises.
Yes, surprises from me. And I'm going to spotlight Peter. Over to you, Peter.
Gosh, hello. This is the drawing I've done. Living systems leadership on the left is probably the key focus here, with lots of hexagons and with people with different ways of seeing. So there's the telescope inverted, and there's a like a search magnifying glass, there's binoculars, and I wanted to give all these different characters these different ways of seeing. Yeah.
Oh, this is so rich. We are blessed. We are blessed with all of the live illustration help. I print them out sometimes and have them by me. The way you give sort of, I don't know, characters to the images, like the honeycomb. It's so lovely. I think we thank you, Pete, and we thank your colleagues very,
Thank you.
Oh.
Thank you. It's a pleasure. It's a real pleasure and a privilege. Thank you.
Thank you. Everybody, we don't want to stop, but time has come. Can I thank you all? We will go on. This was an optimistic, joyful, positive session about a leadership style that we all recognize and we know that it works. We see it in others and we love it. And as Holly said, there is a lot of opportunity now to help it come out, and that's what we're focused on. Thank you all so much. Bye-bye, and have a